everybody. They say your eyes are the window to the soul, but what about your mouth? Can your dentist detect problems with your overall health when they look inside? The answer is most definitely yes. Here to tell us more, please welcome dentist Dr. Karan Wade. Hello, Dr. Wade.
How you doing?
Good. What's so good about this is that, so many doctors are so interconnected in that we might not be going to a cardiologist because we don't think anything's wrong, but the dentist can say, just want to let you know.
Exactly. A lot of people don't realize the correlation between your physical health and your oral health. They think that they're two separate entities.
Well, we think of vanity. We always think about this. If my teeth are white and pretty, then I am healthy.
Then I'm healthy,
right.
Right. But you have to make sure that your gums are also healthy, because your gums have a lot of bacteria. Your mouth has bacteria in it. We all have bacteria in our mouth. So that bacteria can sometimes get down into our gums. You know how sometimes you can brush your teeth, your gums will bleed?
Right.
Some people think your bleeding gums are normal, but it really isn't. Your gums really shouldn't bleed unless you really traumatize your mouth. Your gums really shouldn't bleed. Your gums should be healthy. It should be a normal pink. They shouldn't be red. They shouldn't be puffy like this. This is example
which can be a sign of periodontal disease.
Exactly, absolutely. And patients who have periodontal disease, usually they have other underlying health conditions.
Okay, so heart issues is one of the things we're talking about.
You can have, it can lead to heart attacks. People don't realize that the bacteria that's in your mouth can adhere to the platelets that's in our bloodstream and clog up those arteries and cause you to have a heart attack. You can also have a stroke. You can also, women who have are in childbearing age, they can have preterm labor because that same bacteria that's in our mouth can get in her bloodstream and travel to the baby and cause her to have preterm labor or even miscarry.
You all can also get an indication whether somebody might be pre-diabetic or diabetic.
Absolutely. There are a lot of patients that come to my office and they say, my mouth is dry, I'm having problems with dry mouth, I got a sore in my mouth that won't heal. And a lot of these patients are diabetics and they don't realize it because they haven't been to their medical doctor to be diagnosed as being a diabetic. And I have picked that up in a lot of patients, and I said, you need to go see your medical doctor. You probably have diabetes. Of course, I can't diagnose they have diabetes, but more than likely they really do because they have symptoms of they can't have the ulcers in their mouth just don't heal. They don't heal very well at all.
All right. The other thing is there are times that people may come in and you have an idea that they're not functioning, their teeth aren't functioning correctly, but they think they have to live with that. So a lot of times elderly people will come in.
Oh, yeah, absolutely. A lot of elderly people come in. They have ill-fitting dentures, ill-fitting partials, and they think that there's something they have to live with. They really, really don't. And this also can be a problem for especially the elderly because they're not chewing their food correctly. They start having problems with digestion. They start having all these other symptoms, GI problems, and it's all a direct correlation with their teeth.
Okay. The second one, this is really interesting because there's a point in our lives as children where your teeth don't look right at all because you're getting rid of the baby ones, getting some new ones, and the whole bit. And so there's a battlefield in your mouth. But oral health can also impact children's learning?
Yes, absolutely, because children, they'll have cavities and they'll be complaining about their mouth hurting, but they can't really identify that it's actually their tooth or their teeth. And they go to school, they're not paying attention because they're in pain, and a lot of people don't realize it. A lot of children eat this thing, it's called Lucas. It's really like a Mexican seasoning, and that stuff is just like pouring salt on an ice cube because it starts to break their teeth down.
Oh, okay.
Yeah, absolutely.
All right, so things that we need to do to prevent issues here. One is prevention, flossing. And I know, how many of you, okay, just tell the truth here, this is an honesty game, how many of you floss every single night? Okay, well, a couple of you will still have your teeth in a few. But we always say that we're going to, especially when you get your teeth cleaned and you leave the dentist, you go, from now on, I am just going to floss all the time, right?
And a lot of people don't realize, you can brush your teeth all day long, but the toothbrush can't get in between your teeth, and that floss will remove the food particles that are left after you get through eating. If not, the bacteria in your mouth are just going to have a field day.
Yeah, it's part of the problem that we're living longer, so we're outliving our teeth, so we have to take better care of them.
Absolutely, and a lot of people think, I had a patient come to my office the other day. He said, well, I'm getting older. He's like 30. He said, well, I'll probably lose all my teeth in a few years. I was like, no, that's not true. Just because you're getting older does not necessarily mean that you're going to lose your teeth. I mean, your teeth are made to endure for a lifetime.
All right. Other services that you do, because there are things that happen. Sometimes I mentioned vanity earlier. Sometimes we just want whiter teeth because of all the stains we've put on over the years. So you can take care of veneers for people, crowns and bridge work.
Oh, absolutely. A lot of patients, they'll need crowns, bridges, veneers. We can change your smile. We can, you know, change.
That's incredible, right?
Yeah, that's also before
Wow.
and after some patients that have problems with their teeth and they just want a better smile.
Wow. Wow, wow, wow. All right, yeah, veneers, lumineers, also braces, which, you know, you can do the full-on braces or
the Invisalign braces, Invisalign. Yeah, a lot of people don't want that metal mouth of us, so they'll choose to go with the Invisalign braces.
So I'm thinking about the metal mouth because I'm thinking I might look 16 if I have them. You know, it's like, hey, how are you? But anyway, Dr. Wade, thank you very much for the education part of it. And again, if you're having any issues with your teeth whatsoever, all the way from essential cleaning to getting veneers, Dr. Wade's office can do that. You can take advantage of her special offer just for Great Day viewers. The first 25 people to call her office and say they saw her on Great Day will receive a free dental exam and a cleaning. Call her office at 713-654-7756, 713-654-7756. You can also find out more on Dr. Wade's website, cosmeticdt.com. Thanks again. After the break, the thing you can do today, right now, that will save you as much as 15% on your summer electricity bill.